today. Sorry, we're a minute or so behind, but today we're excited because we'll be talking to uh, we have a great town hall for us again to get today. I'm Council President Shannon Hart, and I have the pleasure of serving you as Council President. Today we will hear from my colleagues, Councilmember Shayla Favors and Councilmember Rob Dorrance, and I see that we have several of my other colleagues with us as well. President Pro Tem Elizabeth Brown and Councilmember Mitch Brown is with us as well. Today, we'll be talking to Columbus Public Health Commissioner Dr. Myshika Roberts. She'll provide us again with a status update on COVID-19 in Columbus and lay out how Columbus Public Health is responding. Then we'll hear about the city's financial outlook and what the latest economic news is from our Auditor Megan Kilgore. After that, Councilmember Dorrance will talk with Sarah Ingalls, who's the board president at the Central Ohio Workers Center. They'll talk about navigating unemployment and efforts to support working families. And finally, we will hear from our housing chair, Councilmember Shayla Favor, and Michelle Heritage, leader of our Community Shelter Board. They'll lay out what the city and the Community Shelter Board are doing, are working on to protect our Columbus's most vulnerable residents. We've been collecting residents' questions by email and social media. Our council members and special guests will be answering some of those questions with us today. Once again, this week we have interpreters for American Sign Language from the Deaf Services Center. Thank you so much for being here and helping to make sure that all of our residents can participate in this town hall. At this time, I'd like to welcome our Health Commissioner, Dr. Myshika Roberts. Thank you again for joining us. Thank you for all the work that you and your team are doing. Again, would you please take that back to them? We really, really appreciate your keeping us safe, and we appreciate it.
Thank you. Thank you so much, Council President Hardin and others on the call today, and thanks for having me. And again, I will share that with my team. I'm very, very proud of my team and the work that they've been able to accomplish over the last several weeks. And so we're doing our best to keep our community healthy and safe during this COVID-19 pandemic. Just wanted to provide you with some information today on where we are with cases of COVID-19. As you know, the state of Ohio has over 7,000 cases of COVID-19 and just over 300 deaths, unfortunately, of COVID-19. On today's press conference, Dr. Acton and Governor DeWine shared that just in the last 24 hours, there have been 50 people across the state of Ohio who've lost their lives to COVID-19. So I just want to put that in perspective of how serious of an illness this can be. Yes, some people can recover. Some people don't need to be hospitalized, but others have some severe complications, and obviously some even lose their life to this infection. Right here in Columbus and Worthington, as of this afternoon, we have 741 cases of COVID-19. That includes 9 individuals in our community who've lost their lives to COVID-19. 55% of our cases are female, and 20% of our cases have required hospitalization. And to put that in perspective, of the 20% who did require hospitalization, 30% of them required ICU. So they were really sick and needed to be in the intensive care unit. And 23% of our cases are among healthcare workers. So these are individuals on the front line caring for the sick who are exposed to COVID-19 and end up becoming sick themselves. We've been looking at the race and ethnicity of our cases for the last week or so, and for the most part, we have some complete data. Our incomplete data ranges anywhere between 10 and 12%. But I can tell you that in the city of Columbus, African Americans represent about 29% of the population, but African Americans represent 30% of our COVID-19 cases. And then they represent 38% of cases of COVID-19 who require hospitalization. And they're representing 25% of our deaths due to COVID-19. The age range for our cases, the highest age group continues to be that 20 to 29-year-old. Second to that comes the 30 to 39-year-old. Saying that this is a disease that makes those who are more vulnerable more susceptible to the complications. And those who are more vulnerable, again, are older adults over 65, as well as those who have chronic conditions like diabetes, hypertension, and asthma and cardiac disease. That's why we're seeing some of the disparity we're seeing with hospitalizations, because we know that African Americans are disproportionately affected by some of those chronic conditions that I just described. Over the last probably 10 days, the CDC has put out new guidance that they're asking everyone when they do leave the house to wear some type of covering on their nose and mouth. They want to reserve the N95s and the surgical masks for our healthcare providers, but really encouraging individuals to make their own face mask, either with a bandana, a headscarf, or some kind of way covering their nose and mouth when they do go out in public to do those essential functions. But keeping in mind, they still need to practice that 6 feet of separation between them and the person next to them. They should still wash their hands frequently, and they should avoid going outside unless it's to get health care if they are sick. So again, if you are sick and you're experiencing symptoms that seem to be consistent with COVID-19, you should be staying home unless you're going out to get health care. Again, if you do think you have symptoms consistent with COVID-19 and you live here in Columbus or Worthington, I encourage you to first call your healthcare provider and talk to them about what's the best next step for you to get evaluated. If for some reason you don't have a healthcare provider or you don't have health insurance, Columbus Public Health is here to assist you, and we encourage you to call 614-645-1519, and I'll give that number again. It's 614-645-1519. And there you can reach one of my public health colleagues that will help you if you are symptomatic and try to get you the best care possible. I think that's it. Again, I really want to remind people that from a numbers perspective, we seem to be doing well here in Ohio and here in Columbus. Everything that we've been asked to do by Governor DeWine, by Dr. Acton, by Mayor Ginther, and by myself, we've been complying with, and that's good. But it's too early to let our foot off the gas. We need to continue to do that. We've gotten through some important steps. We've probably got at least another week or two to go where we can maybe start seeing some changes happening in terms of our activities, maybe. But it's important that we stay home. We only go out for essential services. And then when we do go out for those essential services, we make sure we cover our nose and our mouth with some type of covering or mask. I'm happy to entertain any questions you might have at this point.
Thank you, Dr. Roberts. We have one question that I wanted to ask you from a resident. It says, some have said that there could be a second spike of cases later this year after we hit our initial peak in the week or so. Is that your understanding of public health? Is that what we prepare for as we think about our new normal, as we start to think about what comes next, really?
Yeah, absolutely. And that's a great question. And our new normal is going to be very new. It's going to be different. And so I think everyone needs to prepare for what that might be like. You're seeing some hints of that by some of the elected officials across the country saying what they think the new normal will be like. You know, Dr. Acton said this yesterday, that she thinks we're likely going to be asked or encouraged to wear a mask or some type of covering for maybe another year. It might relax at times, but to anticipate that. In terms of another surge, our national public health experts are telling us that we will likely see another surge. And that new surge or that additional surge could come as early as June or July. A lot of that depends on how quickly or how slowly, but mostly how quickly we go back to normal. If we go back to normal too quickly and we start allowing people to leave their homes and do their normal activities, we could see that surge as early as this summer. Then another possibility is that surge could come later, like in the fall. So there's a lot of unknowns there, but I do anticipate we will see another surge. I'm pretty confident in the guidance that we're getting at the state level, that we're going to do everything in our power from a public health perspective to give the right guidance and the right direction to try to limit that surge as best we can. But, you know, it's really a testament to our community. What we're seeing thus far is because everyone's been abiding, for the most part, by the restrictions and staying at home. And so if we can get more people to do that, Only go out when it's necessary. I know people want to break, they want to get out of their surroundings, they might want some fresh air, but it's really important that if you feel that you need that you do that someplace where you're likely not going to be exposed to other people. Go take a walk in your neighborhood, go take a walk outside, but going into a facility, whether it's a grocery store or any other convenience store just to pass time, could put yourself and others at risk. So you really want to give yourself that 6-foot distance and avoid being around other people when you can.
Thank you, Dr. Roberts. And it really is because of your team and all the work of the healthcare folks and all those folks on the front line that we are in a better situation. And like you said, we still have a ways to go, but we appreciate your leadership. So thank you so much for being with us.
Thank you.
Before moving on to Auditor Kilgore to discuss city finances, I want to give a quick thank you to all of not just our first responders, but all those folks who are on the front lines who have had to put themselves in harm's way to keep our communities moving forward. That's certainly our healthcare workers, our police, our firefighters, but also our CODA bus drivers, our Kroger's workers who literally had to put themselves in harm's way so that we could continue to move. So thank you. We're asking so much from so many healthcare workers. We want to encourage all of us to put out a message of encouragement and thanks to all those folks for serving our city right now. Speaking of public servants, I'm now joined by our city auditor, Auditor Megan Kilgore. Thank you so much for being with us today. Just going to give you a few minutes or as much time actually as you would like to speak about how our city finances are looking. And we have just a couple questions if you have time at the end from some of our residents.
Certainly. Good afternoon, and thank you for the opportunity to present today, Council President Hardin and fellow colleagues. Normally, this would be tax day eve in our office, but as a reminder, we have also adopted the IRS's new tax deadline of July 15th. As you guys know, income tax revenues are really what fuel our city. Income tax revenues are what pays for our public safety, our parks and rec and road projects. And so something like COVID and a pandemic that impacts so many jobs and the ability for people to earn revenue, that will obviously carry implications to the City of Columbus's own revenue collections. So we in the auditor's office are studying two parallel tracks of our economy right now. The first, we're looking at our small and medium-sized businesses, and we're also studying our top employers. Our top employers are the lions in terms of tax revenues, but we will no doubt see revenue loss from the aggregation of our most vulnerable industries, that being our salons, our shops, our restaurants, hotels, tourism partners. So we're collecting a lot of data and sharing that information so that we can be, frankly, best supporting our businesses who are trying to figure out how to navigate COVID-19. And I know how important small businesses are to Council's agenda. So today I'd like to start by looking at the impact COVID has already had on our small business economy here in Columbus. So Mark, head on over to slide 2. So per the last time this was counted, the American Community Survey, there were 15,000 self-employed residents here in the city of Columbus, 15,000. If these small businesses are unable to successfully work via electronic platforms, certainly a very large question we have to ask ourselves is, how long can these small businesses last? So we're looking at both the existing liquidity, meaning cash on hand, and the ability for these businesses to pay their bills today. And in the long term, what are their financial health challenges to see where we can, as a city of Columbus, best come in to help. Take a look at next slide, Mark. This is a really interesting chart. Up until COVID, the city's small businesses were really on an upward swing. There were more business startups succeeding than failing. The last time, in fact, that there were more failures than successes was back in the 3 years of the Great Recession. You can see the downward decline there of business successes, the blue line. That period of the Great Recession is what, frankly, we want to do everything that we can to avoid again. So what we have to do is bridge the gap for these small business owners. You know, frankly, these small businesses facing financial failures today did not create the crisis unfolding in our national economy. And their vulnerability right now really does stem from these emergency closures and other things they just cannot control, but are obviously for the greater good of public health. Here in the office, we're going to continue evaluating this, the Paycheck Protection Program, and see how that continues, and then adjust and see where the city can best support. For the viewers today, one request that I do have, if you or your company have fallen in the gap, meaning you do not qualify for the PPP, but you are in need of financial support to be able to bridge this path until our businesses reopen, let us know. The email address is at the bottom of the slide, bottom left. It's cityauditor@columbus.gov. You can also go to the city auditor's website and find us from there. The reason being is because we're playing a really active role right now in the national conversation. And as we look at these additional layers of stimulus, the more that we understand those companies that are falling in the gap here, the better we can be a partner in communicating that need. So let's move on to the next slide. I want to start thinking about the future, and Dr. Roberts' comments were on point to where I'm thinking about the economic implications. When I think about, Columbus and our strategy here for reopening, we're not going to be able to flip on a switch per se and turn the economy back on here in Columbus. Instead, the metaphor I've been using is that of a dimmer. It will take time to shine economic light back into our community in order to mitigate the likelihood of those flare-ups that Dr. Roberts was talking about. There are challenges. We will have to consider, recurrence. We also have to consider, consumer fear going to the stores, employee fear working in, places that are large rooms of individuals all working very closely together. And so the best thing that we can do here at the city is to frankly help our businesses plan. As we get that direction from the state of Ohio, we want to make sure that each of our businesses is able to be successful and keep their clients and employees healthy, and that they have the appropriate tools and the protective equipment to do so. So let me talk a little bit. Let's move on to our largest employers on our next slide. I want to talk about the largest employers for a bit because they really do represent a very sizable portion of our local economy. And so what we've done is we've started a process called health checkups to understand for each of these major employers how they are faring during COVID. Our top 50 employers alone represent a sizable portion of our tax revenues. So it's really, like I said, in lockstep with looking at the aggregation of all of our small and medium-sized businesses. We have to keep an eye on these lines. So what we're trying to do is have one-on-one conversations with these major employers to understand how they're working and really trying to understand how COVID-19 has been disrupting their operations, maybe delaying projects or affecting staffing, which would obviously carry consequences to the city's finances. And from the data we've collected, what we've done is we've applied a vulnerability score. So as of this week, and we're doing these weekly, you can see that 28 of our largest employers are largely working as normal, as expected, and their financial forecast for us have not changed. 8 companies are already showing some additional disruption, and we're keeping a close eye on them. Depending upon the duration of COVID, they may have to enter furloughs or some sort of layoff strategy. So again, we're just keeping a watch on these companies. The next tier, the 8 companies in yellow, they have already experienced disruption beyond what they're able to necessarily support from their balance sheets, and therefore we need to build in some conservative revenue adjustments to plan for that. And the companies in some variation of red, they have already performed some level of furlough or layoff strategy. So as you can see, given the size of these major employers and major taxpayers, it's critical for us to evaluate. So we're going to keep doing these weekly health checkups and look forward to sharing that information with you. And again, the aggregation of the retail, restaurant, hotels, salons, entertainment jobs, collectively, this will be what causes the city of Columbus's revenue to shift downward as a result of the COVID pandemic. So move on to the next slide, and I want to just kind of give you a recap of where we are this week. And this is what I would like to share with the residents. It's very, very important that we all acknowledge that revenue forecasting will change weekly due to the spread, the duration, and consumer behavior. What we do know is that this is going to affect Columbus for quite a while to come, and it is most responsible for us to triage the economic impacts of COVID. Here's what we know today about the city of Columbus, though. We have strong fund balances in place. Income tax is up year over year. We have strong balances in our rainy day fund and other reserve funds. And our key employers are still at work. They may be working differently, for example, working from home, but they are largely still producing, paying salaries, et cetera. As we all acknowledge, we take a lot of pride in our fiscal planning, and I believe we're in very good shape as a city, given, frankly, our financial foundation right now. So our focus in the auditor's office, and I know in council, is really on support for our small and medium-sized businesses who are the most vulnerable. You know, as a city, we have to prepare ourselves, like many of you at home, for a tough second quarter and third quarter. We will have revenue declines, but until we have a better sense of spread and duration, it would not be prudent for us to make any revenue adjustments. We're fortunate, though, that we're very early in the year. Tightening our belt is doable, and I'll be making recommendations as we get further into this. Just like in our homes, the more we can do to control our expenses today, the stronger we'll weather this. Thank you very much for your time, Council President. I'll turn it back to you.
Thank you, Auditor. If you have a minute or two, we have two questions, kind of, and they're almost similar. If you're able to answer with this.
Sure, please.
Thank you. So they're both rainy day related. The first one is just explain what a rainy day is and how does our rainy day fund compare to some of our peer cities around Ohio. And then kind of the follow up is that if we get to a point where we would need to remove some of the reserves in the rainy day, how would that impact us, either bond rating, credit rating, or how folks would view our financial fiscal health?
Sure, it's a wonderful question. The rainy day fund acts a lot like a savings account for a family. And it's a savings account that we try to leave in reserve because we spend a lot of time, rebuilding that. And it's a very important aspect of a city's fiscal foundation to have those resources available in times of complete distress. Much like a family, though, what I would suggest is that rainy day funds should only be accessed when we have already exhausted things like eliminating the non-essential expenditures. As you know, we've already, my office is the entire revenue side. The expenditure side, which is the mayor's office, and of course with council's approval, there have already been great strides made in eliminating those non-essential expenditures. Things like being very careful about staffing, things like hiring, I should say, things like being very, eliminating travel. There's frankly, a tried and true practice of looking at each of those expenditures line item and tightening our belt. That's really step number one. Number two is I would remind, the residents, we are a AAA rated city. What that means in plain language is that just like human, individuals have credit ratings, the city of Columbus has a perfect score. With that perfect score, part of that comes our score is due to our adherence to good fiscal policy and good fiscal planning. Our reserves are part of what makes us a AAA rated city. So our reserves are in line with a city of our size, and they represent a large portion of our annual expenditures. So they're right in the appropriate line for where we need them to be. But the steps will be eliminating those non-essential expenditures. And then, as we get to understand spread and duration, then we can make collectively as a city thoughtful decisions. But I correlate it just like, Council President, just like a family trying to figure out how to tidy up a little bit with their household expenses right now and be thoughtful as to the things we cannot control down the road.
Thank you, Auditor Kilgore. We're really appreciative to have your steady hand leading us and guiding us as we go through this crisis. So we appreciate you. Thank you for giving us time. So
Thanks,
moving
sir.
on to our next segment, I'd like to introduce Councilmember Rob Dorns and Sarah Ingalls. They're going to share the latest info about how the city, state, and federal government are working to stabilize families. Thank you, Councilmember Dorns. Councilmember, the floor is yours. Oh, that sounds good saying that. It's been a while.
Yeah, it has. Thank you, Council President Harden. Just wanted to take some time this evening to talk about some of the work around unemployment compensation that's really a lifeline for a lot of families that are out of work right now. We know that this is not only a pandemic when it comes to the public health crisis, but this is an economic crisis for thousands of working families here in Central Ohio and across the country. So a lot of folks right now are accessing the unemployment compensation system for the first time. And they're finding out that they may be eligible for benefits, they may not be eligible for benefits. There may be some documentation that they need to be able to provide to access those benefits. So while unemployment compensation is not a program that's run by the city, something that my office has tried to do along with lots of other folks is to lift up the right kind of information and make sure that folks are getting access to those unemployment benefits as quickly as possible. Because we know that the families in our need those benefits in order to make sure that they're putting food on the table and taking care of the necessities. One of us here tonight, she is the president of the board of the Central Ohio Worker Center, which is an organization. I think I may have lost everyone. Okay, I think I'm back. That's president of the Central Ohio Worker Center board that works to provide workers in our community with the resources to make sure that they're getting paid appropriately. And she's a local attorney here in town that also works on the employment side and helps navigate these kind of benefits for folks. So Sarah, with that, I'd love for you to introduce yourself for a moment.
All right. I think I'm off mute now.
There you go.
My name is Sarah Ingalls. First of all, thank you, Council President and Council members, for having me on here and allowing me to speak a little bit about the Central Ohio Worker Center. We are a 501c3 nonprofit organization that's dedicated toward advocating for and with low-wage and immigrant workers. And what we're seeing out of this COVID-19 crisis is that 696,000 Ohioans have filed unemployment compensation claims. Just last week, it was reported 226,000 had reported filing an unemployment compensation claim. That's about 12% of the jobs in Ohio. So this crisis is definitely taking an effect on workers, and it's hitting low-wage and immigrant workers especially hard. Many immigrant workers, especially undocumented workers, will not qualify for unemployment benefits because of their status. And many of our low-wage workers are working as essential personnel. So they're going to work every day and working the jobs that are very tough and often very dangerous. Many low-wage workers are missing paychecks and are being forced to file for unemployment compensation. And we know that the system is a bit slow in the sense that it is taking people a few days up to a few weeks to get through on the phones or via the internet in order to file their claim. We do know that those will be backdated to account for those difficulties, but nonetheless, it is frustrating for a lot of families. There's a lot of uncertainty right now, which is just creating more chaos within the chaos that already exists. But we do know that locally and our state and federal legislatures have passed some pieces of legislation that will help American workers. First, being the CARES Act, which is the Coronavirus Aid, Relief, and Economic Security Act, the Families First Coronavirus Response Act. Those are both federal legislation. And then here in Ohio, we had House Bill 197, which kind of codified some of the orders that the governor put in place and helped expand unemployment compensation benefits for many, many workers.
Thanks, Sarah. I think Council President and I have a couple of follow-up questions to talk about some basics. And then if folks are interested in learning more about the unemployment compensation system in Ohio, Sarah and I are actually going to be doing a virtual community hours next Wednesday. So if folks have more in-depth questions, feel free to tune in. We'll be sending out information about that. But Sarah, could you talk a little bit about the types of documents that folks would need in order to apply for an unemployment compensation claim?
Sure. So when you're going to file for your unemployment compensation claim, you want to have your social security number available. You just need to know the number, and either a driver's license or your state ID. You will need the number off of that. You also want to know your full name, address, a telephone number, and an email address that works for you. And then have all of the information for your employer, meaning the name of your employer. Sometimes that can be difficult for people because, if you work for a place like McDonald's, you say, I work at McDonald's, but oftentimes that could be owned by a franchise. So knowing the name of the franchise is very important when you're filing your paperwork. You want to have the address of each employer that you work for. So if you're somebody that works multiple jobs, make sure you have all this information for all the jobs that you are working, so that when you're filing with the correct information. If you work for a temp agency, the temp agency is your employer. You don't want to use the name of the employer that they last assigned you to. It is the temp agency that is your employer. If you have out-of-state employment in the last 18 months, you'll want to have the name, address, and phone numbers, and the dates that you worked for that employer. If you've been recently separated from military service with any branch of the armed forces in the last 18 months, then you'll want to have your discharge papers ready, which is the form DD-1 or 214. And then if you have worked for the federal government in the last 18 months, you will want to have your SF-8 and or your SF-50, which is a form that's given to you by your government employer at the time of your separation. Additionally, you'll want to have the reason that you became totally or partially unemployed. Many people will give a reason like COVID-19, and that is certainly a big reason for many of the unemployment compensation claims, lack of work, those kinds of things. And then if you have any dependents, you'll want to know their name, their social security numbers, and their dates of birth. If you are married, you would need to know your spouse's social security number, even if you file separately. So you will need to have that information. If you are not a U.S. citizen or national, you'll need to have what's known as your alien registration number and the expiration date of your work authorization, because you will need to provide that information when you are filing. And then finally, you'll just need to be able to explain what your regular occupation is, what your job title was, and the job skills that you had in order to perform that job.
Thanks, Sarah. And I know there's been a lot of folks that have already been starting the application process and they've gotten a little bit frustrated with some of the waits. One of the things that I want to encourage folks is to do as much online as possible. The state of Ohio has been hiring additional staff in order to work on these claims, but this is the most claims the state has ever had in its history. So the more that you can submit those online, the better. One of the questions that I keep getting from folks who are asking this is, how long can someone receive benefits, and will those benefits be provided indefinitely through the COVID-19 crisis? Sarah, could you provide a little guidance to folks out there about how long benefits are available?
Sure. So in Ohio, generally, unemployment benefits are available up to 26 weeks. However, with the governor's extended orders, House Bill 197, and the federal legislation that has come into play, there is an additional 13 weeks added, bringing the total that a person can receive unemployment compensation to a total of 39 weeks. That was expanded by the federal legislation known as the CARE Act. And then as far as whether unemployment can be offered indefinitely, that's really a question of whether or not the legislature will extend the period of benefits. And we've seen that happen in the past. We saw that happen with the most recent recession. So it just kind of depends on the legislature whether or not benefits would be extended, if they would be offered indefinitely. The answer is probably not, but there would be an extension if we got to that point. And really that's up to the legislature to decide. So as it stands right now, a person can qualify for up to 39 weeks of unemployment compensation. And again, that could be extended if there is appropriate legislation.
And those benefits are based upon, someone's weekly earnings and whether or not they have dependents. So, one of the things that people have been asking quite a bit about, what will that benefit look like? And I know Council President Harden's got a question here a little bit about sort of the $600 benefit from the federal government, but just to make sure that folks understand, that benefit amount is going to be different for people based on what their previous earnings were and whether or not they have any dependents in their household. So I think that's an important note for folks to have. One of the questions we've had, speaking about applying, whether calling someone on the phone or whether submitting it online, there's been a lot of folks that have asked whether or not they can actually apply using their mobile device, because some folks' most stable access to the internet is through their smartphone. So, Sarah, is there an avenue for folks to be able to apply online through their phone?
Yes. So there are 3 ways to apply for unemployment compensation benefits. You could call. The number is 877-644-6562 between the hours of 8 a.m. and 5 p.m. Monday to Friday. But what the government is recommending, and what Councilmember Dorrance has recommended as well, is to file online at unemployment.ohio.gov. You can use a mobile device to do that. ODGFS has some guidance around what platforms work best. And the website where you would find if your platform would work is https://jfs.ohio.gov OCOMM/browsersupport.stm. So if you're concerned about your mobile device being able to work, that would be the web browser that you should go to. But most mobile devices, especially smartphones, should work.
Thanks, Sarah. Just one last thing I want to point out before I throw it over to Council President Harden for some additional questions from the community, is that there's been a lot of questions about if someone didn't qualify for unemployment compensation benefits because they're an independent contractor or they didn't meet the weekly amount that's required under the current unemployment compensation system. Ohio is currently building a separate system in order to distribute additional funds to those folks that may be independent contractors. So these are a lot of folks who are gig workers, Lyft, Uber, those kind of roles who are traditionally not eligible for unemployment compensation in Ohio. That program is currently being built. Lieutenant Governor John Husted at one of the press conferences the other day mentioned that they're hoping to have that system up and running in mid-May. I think all of us hope that system gets up and running a little bit sooner to make sure that money starts to flow to working families who need it right now. There's some other states around the country right now that have had those systems up and operational, Michigan being one of them. So hopefully the Buckeye State won't let Michigan too far ahead of us on this here anytime soon. So I know one of the things that folks have asked about when those additional benefits will be able to flow to those workers. But I'd like to throw it over to Council President Harden for any additional questions from the community for Sarah.
I'm not hearing anything. Is anyone else? Okay.
I think I can pick up one of those, Sarah, since he's muted.
Okay.
One of the questions we had come through was about someone who lives in a community that English is not the primary language that's spoken. So what resources may be available for folks who need to access the unemployment compensation system, but English may not be their first language?
Yeah. So I'm sorry, my cat is coughing up a hairball right now. But yes, there are resources available for non-English speakers. Non-English speakers could call 1-877-644-6562. Press number 2 if you speak Spanish, and if you speak a different language, press number 3. There are individuals who are able to assist you in your language. Additionally, nonprofits in the area are able to provide some resources. I know that at the Central Ohio Worker Center, we have some capacity to assist individuals in Spanish and in Somali. And then other nonprofits in the area, such as the Legal Aid Society of Columbus, is able to help people as well and are able to help find interpreters for people in their native language so that they can apply and understand the process.
Thanks. And I think we've got the time for one last question. I know there's been a lot of talk about the federal CARES Act, which you mentioned earlier, providing additional $600 a week for unemployment compensation benefits for those who are eligible. There's a lot of people who've already been approved by unemployment comp here in Ohio. When should they expect that extra $600 from the federal government to be able to be provided to them? And will that be paid retroactively?
I wish I had a better answer for when you should expect the payment. The answer is as soon as possible and as soon as practicable for the government processing those amounts. So we're hoping that it's soon. Of course, I don't have any specific insight into that. The money is paid retroactively. Of course, it begins with the date that you first file your unemployment compensation claim, but it can be backdated all the way back to January 27th. So if you have filed for unemployment compensation anytime between January 27th and now, the $600 will be retroactive to the date that you filed your original claim.
Great. Thanks, Sarah. I really appreciate you joining us tonight to provide some of those insights for the community. I want to throw it back to Council President Harden.
Thank you for that assist, Councilmember. I can always count on you. I appreciate it. Our next PSA is coming at us from our President Pro Tem, Councilmember Elizabeth Brown. Councilmember Brown.
Thank you so much. Can folks hear me? Okay, good. So I wanted to take a quick moment and highlight an opportunity for engagement with our schools this coming Thursday. During this health crisis, one of the primary disruptions for families has been the closure of schools. We all know this. And in this environment, it is vital that we continue to provide basic resources like proper nutrition and academic enrichment while students are at home. So I'm excited to announce that I will be hosting a Facebook Live event this Thursday, April 16th at 4 p.m. with Columbus City Schools Superintendent Dr. Talisa Dixon and Chief Engagement Officer Alicia Gillison. We want to share information about what resources continue to be available to students and families through CCS and to answer questions. So please check out City Council's Facebook page for more details. I really hope you can join me and learn about the Herculean efforts, truly, that our district is taking to be there for its 50,000 students, the largest district in the state. Parents and anyone who's interested, please join us. Thank you so much, Council President.
Thank you, Councilmember. We'll be there and look forward to watching. So let's move on to our final portion of today's town hall, and that's going to be hearing from Housing Chair Favor and Michelle Heritage, Executive Director of Community Shelter Board. Councilmember Favor, the floor is yours.
Well, can everybody hear me?
Yes, ma'am.
Awesome. Thank you, Council President Harden, and good evening, colleagues and the residents of Columbus. I'm honored to be back today to talk about another important topic in the realm of housing, that is homelessness. Our homeless population is one of our most vulnerable groups as we fight against COVID-19 and the pandemic. On any given night, there are nearly 1,200 individuals sleeping in homeless shelters in Columbus and Franklin County, and there are an estimated 600 on the streets. As more individuals in our community experience job loss and other financial setbacks and the spread of COVID-19, we understand that more individuals and families are finding themselves without housing. So fortunately in Columbus, we are lucky to have an amazing group of partners working closely with the city to address the needs of our homeless community. The Mary Haven Collaborative Outreach Team is a group of agencies conducting outreach to the unsheltered homeless. They have helped to advocate for basic sanitation and hand washing needs for unsheltered people. Locations like our libraries, restaurants, coffee shops, and other recreation centers that individuals would typically utilize are currently not available. But beginning last week, as of April 8th and currently continuing through May 8th, there will be porta-johns, hand washing sinks, and trash receptacles at strategic locations, both downtown and outside the inner belt. With social distancing and quarantine for the sick being a necessity to help stop the spread, there has been swift action to increase our support to the organizations that are doing the critical work that has resulted in much needed additional shelters to address the need for additional space and for those who are sick. So with that, I'd like to introduce and turn it over to Michelle Heritage. She is our CEO of the Community Shelter Board to talk about the work they are doing to help support our homeless population at this time. Michelle, the floor is yours.
Thank you. Can everybody hear me okay?
Yes.
Yes, ma'am.
So I want to talk a little bit about what we've been doing to address the needs of people experiencing homelessness in our community during this pandemic. We're working on two critical pathways. The first critical pathway is to make sure that we are able to obtain the social distancing that's recommended for everybody. If you've been in a homeless shelter, if you've served dinner there, or you volunteered, you know that those shelters are not built for social distancing. People are packed together pretty tightly. They eat in congregate settings and oftentimes sleep in congregate settings. So what we had to do first to stop the spread of this virus is to make sure that we had enough space between people. We began by opening a shelter at 40 West Long Street with our partner, the YMCA. And then another shelter opened recently at Sullivan Recreation Center. The first shelter at the Y downtown has 150 men in it. And the second one at Sullivan Recreation Center has 50 men. This particular center is specifically for men who are older and have vulnerabilities which make them more susceptible to COVID. And so we've got them in a smaller space together. And then later this week at the YMCA Hilltop Ranch, we will open up the third shelter for social distancing. And this will be for women. Once we get that opened, in our entire shelter array, we have enough space between everyone so that they are properly distanced and we can make sure that we slow the spread of this virus. The second critical path is for people experiencing homelessness who are infected by COVID, either COVID positive, they've been tested for COVID and are awaiting results, or they've been certified by a medical personnel that they are having symptoms that would indicate COVID presumptive positive. And also for people who need quarantine because they've been exposed to somebody who's got COVID. We have opened 2 locations, both on the north side of town, and they're in hotels and motels. We are staffing these with the YMCA. They've been an absolutely incredible partner in this. And we are receiving medical assistance from the Medical Reserve Corps, which is being supervised by Franklin County and a team of doctors from Ohio Health to provide the medical services. And then just today, we are opening our second shelter for isolation and quarantine. And that is being, again, done by the YMCA. And the medical is being provided by Lower Lights Christian Health Center, a federally qualified health center here in town, so that we're able to do that. And then our colleagues at the Franklin County Adam H. Board have come alongside us, and they are going to provide behavioral health care on site. We'll have a navigator that will be in these shelters for isolation and quarantine, which will help make sure that everyone's needs are being met in terms of their behavioral health. I want to just take a moment and to thank all of you at Council and folks in the Mayor's office and all of the staff. You have been so incredibly supportive. We are in Columbus prepared and we are ready for this surge. And we are doing it the right way. And we're only able to do that because of your support and because of the teamwork of so many people who have stepped up. We would not be where we are if it wasn't for your partnership. You've blocked and tackled for us. You have untied some really tough Gordian knots. And you have really just made it possible. So I just want to say here in front of everyone, our gratitude it runs deep, and we are going to be able to meet the needs of these very vulnerable folks thanks to you and many others who have come alongside to help.
Thank you, Michelle. And I think I could speak for all of my colleagues. We, without a shadow of a doubt, extend our appreciation for you and everyone within the shelter system, that ecosystem that is fighting for our homeless folks every single day. and have jumped into action to make sure that Columbus is absolutely ready if and when we need to execute on these plans as you have discussed this evening. Council President Harden?
Thank you, council member. And I think you articulated our appreciation for the shelter system correctly. This is truly an example that we are all in this together, and the way that we've rallied together to make sure that our most vulnerable are safe is something that I'm really appreciative of. We have several questions from the viewing public. I'll start with one. This question says, CODA just mandated that all passengers riding the bus must wear a face mask. And the area commissioner is concerned that it is greatly impacting, or that it will have a great impact on our homeless individuals, and wondered if there is any outreach efforts to get masks to CODA riders that are unable to obtain them. Councilmember, would you be able to handle this question?
Sure, absolutely. So the question is referring to CODA's new policy that will actually go into effect tomorrow. That's April 15th. That is requiring all individuals riding the bus to cover their mouth and nose completely with a mask, scarf, or a bandana. While we don't currently have a complete solution to ensure homeless individuals have access to masks while riding the bus, we're open to all creative solutions to address this great need. I know there are a lot of folks that are being creative at this time. I myself released a video today showing how to reuse a piece of old fabric that I had laying around to create a mask. I know that there are a lot of individuals in our community that are also stepping up and creating their own cloth face mask to donate. And so I know that there are folks that are working around the clock to help fill that gap for our folks who are currently experiencing homelessness right now. Michelle, do you have anything additional to add there?
We've really been working hard to get folks experiencing homelessness the masks that they need. And we've been working in partnership with CODA on it. They know that this is a challenge. We got a large donation just recently, yesterday late, from OSU Medical Center, Wexner Medical Center, that we've distributed out to our shelters. We've literally ordered thousands of masks through Ant Flow, and we'll be picking those up tomorrow and distributing those out to our shelters. And then we're expecting a large shipment this Friday from Ohio, who is donating a large supply of the surgical masks. We are literally going to keep ordering these by the 10,000s to make sure that people have them, because as you know, for a lot of us, we get masks and we can wash those. They want you to wash those once you wear them a couple times. And for folks experiencing homelessness, that's a challenge. And so we're really looking for disposable masks to the greatest extent possible. And we are also handing out some of those cloth masks. And so again, I just want to say thank you for all that you're doing there. And once again, the community is stepping up to help.
And we just want to reiterate, as Dr. Roberts indicated earlier today, that we want to save those N95 medical masks for the health professionals. Those are the folks that are on the front lines that absolutely need a great mask. And so the directive from CDC, as well as what CODA is implementing, is a policy that allows for a cloth covering. And so that can be a bandana, it could be a scarf, anything just to cover your mouth and your nose.
Thank you, Councilmember, and thank you, Michelle. That was really good information. We have a question just basically asking, during the stay-at-home order, is the intake process different for our homeless population? Michelle, maybe you could answer this.
Yeah, absolutely. So just like the rest of us, we want everyone to stay put. And so one of the things we've done is we have kept the winter overflow beds all open. And so the system right now is able to shelter anyone who wants shelter and needs it. And so there's not a fixed capacity on the beds. We're keeping everything open so folks can come inside. And they would get to the homeless shelters in the typical way, which is to call that homeless hotline. That number is 614-274-7000. Again, 614-274-7000, and folks can enter the system that way. And we've asked our shelter partners to go ahead and let everyone stay at the shelters throughout the day. It's really we don't want them kind of going around and being outside. Of course, just like the rest of us, people experiencing homelessness have free will, and so they can go about their business as they need to. But we've really been trying to put a fine point on it for everybody, that you should only be on the street if you're doing essential business, that you have an appointment, that you're going somewhere, that you need to be, and especially the Kovat bus riding. Want to make sure that when folks are riding Kovat buses, it's for an essential business need, that they're getting something done that they have to get done, an appointment or some kind of a medical thing or other. So definitely it's a challenge, but we do have adequate space at this time to meet the needs.
Thank you so much, Michelle. I think our final question is kind of an open question, probably to Councilmember, and Michelle, feel free to jump in. The question is, once this crisis ends, what are the plans to continue services and find permanent homes for homeless folks?
Michelle, please.
So, we're really concerned. I have to tell you, it's going to be a big challenge in terms of many people who were living close to the edge and were making it, are going to be especially challenged. For people, as you know, who may not have a lot of income to begin with, having their hours cut, their jobs cut, getting behind on their rent by 2 or 3 months, puts them in a position to become homeless. And we could see a big spike in the number of people that need our services. And so I think the most important thing as a community is that we use prevention. And there's lots of ways that you can continue to help stabilize people in their current housing and keep them from becoming homeless. And we're going to need to do those things to meet those immediate needs of people until they can get back on their feet. For folks that do become homeless, the key is we've got to get them out of shelter as quick as possible. And that means that we've got to do what's called rapid rehousing. And we've got to help them with paying some of their rent. We've got to help them find their jobs, get reconnected. If they need help, paying back bills, we need to help them with that. And so we know how to do these services. Columbus and Franklin County is a national model, both on the prevention and on the rehousing side. We've got a huge task ahead of us, but everyone's in alignment. We're working on the same page, and I'm confident that this community is going to respond to the greatest and highest extent possible for the citizens of our community.
Well, thank you so much, Michelle, and to Councilmember Favor. We really are appreciative of the work that you guys are doing. And certainly, Michelle, please keep up the good work, and we're here to continue to support you. I want to thank all of our participants who have helped make tonight's town hall possible. Before I do closing remarks, I'd like to kick it to my council members for closing remarks, starting with President Pro Tem. You have any closing comments this evening?
Just that I hope to see folks on April 16th, see you virtually, right? And I really appreciate the time of each of the women who joined us on this call to talk about what our community faces. Thank you, Council President.
Thank you, Councilmember Dorns. And I will have to say, Councilmember Dorns, that Miss Mary Ricketts is following us, and she had a question that did not get answered. And I was rejected from unemployment benefits because I didn't meet the requirements of making the $269 weekly dollar amount. Is there anything in place to waive this requirement in order to qualify? I didn't know if you would be able to, and if not, we would we'll make sure to get her the appropriate information.
We will follow up with her. There's a short answer and a really long answer, so I'd rather give her the really long answer that has more information. So we'll follow up with
Thank
her.
you.
But that's a great segue. So Sarah and I are going to be doing a community hours next week on Wednesday starting at 5:30. That we're going to be talking a little bit more in depth about unemployment compensation questions just like that. So we'll get Mary an answer to that question, but we'll also be able to take questions from other folks in the community that may have a little bit more of an in-depth question that we can answer at that point. So Folks, if they've got interest, if they've got friends or family that are going through this application process right now, you'll have Sarah and I next Wednesday at 5:30.
Thank you so much, Councilmember. Councilmember Favor, do you have any closing remarks?
I just want to just close by saying that I know that there's a lot of uncertainty and a lot of uneasiness out there. We are all literally in this together. We feel those pains and that uneasiness with our residents. But I just want to continue to convey the message that each and every one of us continue to get up every single day within our respective committees, thinking creatively how to bring the very best solutions for our community. And whether that's advocating to our congressional delegation or working with our folks at the State House, we are doing what has never been done before. And so I know that everyone wants answers and we deserve to have answers. But we are really working to figure this thing out every single day. Information changes every single day that we get from the top down, and we do our best to try to communicate that information. I want to truly thank the residents for joining us tonight and participating in the town hall. Shows that you truly do care about the longevity and the success of our community. Have a wonderful evening, everyone.
Thank you, Councilmember. I see Councilmember Mitch Brown is with us. Councilmember, do you have
Thank you,
any?
Council President.
There he is.
I just want to remind people also, not only do you want to cover your face and nose, but also hand covering is important as well. Things get transmitted to a variety of different ways. And say thank you for all of our guests who participated in the program this evening, and thank you for hosting, Council President.
Thank you, Councilmember. Thank you for being with us. And finally, my colleague, Councilmember Emmanuel Remy. Councilmember, you have any closing remarks?
Thank you very much, Council President Harden. Appreciate the opportunity to sit in and participate on these things, and certainly all of my colleagues for the work that they're doing in their respective areas. Thank you to the experts that were on today. The resources that are being provided and the work that everybody's doing to make sure that people feel that their questions are being answered and that their concerns are being heard. We applaud all the efforts of our partners. It's been it's been a really great opportunity to hold these town halls. We look forward to doing more of them. And so thank you, Council President Harden, for hosting, and looking forward to seeing my colleagues on the next one.
Thank you, Councilmember. And again, thank you to everybody who made today's presentation, Town Hall, possible. Want to remind everyone that you can find a complete list of resources at columbus.gov/COVID-19 resources. As Councilmember Remy was saying, we're excited to hold another town hall. However, we will not be here next Tuesday because we are coming back as a council to have our virtual meeting, which will take place at our regular time this coming Monday at 5 p.m. However, we will be back the following week on Tuesday, April 28th for a new set of topics and to hear updates from council members and communities. I would say look for instructions on how you can engage in our council meeting on Monday. It is really important as we come back, as we talk to Dr. Roberts about our new normal, that as we move forward with our virtual council meetings, that residents still have the opportunity to engage, to weigh in, to kick the tires, and but also to let us know how they feel about the legislation that we are considering. That is paramount as we reconvene our council meetings in this new way for the next several meetings. And so we look forward to you being engaged. We will have that information on our Facebook page on how you can actually see the legislation that we will be considering and how you can also engage to make sure that you are participating as we continue to move our city forward. I want to thank everyone for being with us tonight and have a great evening.